Understanding the association between Horner syndrome and Erb's palsy. Horner syndrome is a rare condition that can sometimes be associated with Erb's palsy, a type of brachial plexus injury that affects the upper nerves of the brachial plexus. Erb's palsy is typically caused by birth trauma, often during a difficult delivery. It results in weakness or paralysis of the arm, and in some cases, it can be associated with additional symptoms such as Horner syndrome. Horner syndrome is characterized by a triad of symptoms. 1. Ptosis, drooping of the upper eyelid. 2. Miosis, constricted pupil. 3. Anhidrosis, lack of sweating on the affected side of the face. The sympathetic nerves control the muscles of the eye and regulate the size of the pupil. When these nerves are affected, it can lead to the characteristic features of Horner syndrome. The physiopathology involves the disruption of sympathetic nerve fibers within the brachial plexus, a network of nerves that originates in the neck and extends into the arm. To understand this process, let's break down the physiopathology step by step. Erb's palsy is often caused by birth trauma, especially during deliveries where excessive traction is applied to the infant's head and neck. This trauma can result in stretching or tearing of the nerves in the brachial plexus, particularly the upper nerves C5 and C6, involved in the formation of the sympathetic nerves. The sympathetic nervous system is a part of the autonomic nervous system responsible for the fight or flight response. It includes sympathetic nerve fibers that travel through the brachial plexus to reach structures in the head, including the eye. The brachial plexus injury in Erb's palsy affects the sympathetic nerve fibers, leading to a disruption in the transmission of sympathetic signals. This disruption can occur at various levels, such as the roots, trunks, or divisions of the brachial plexus. The sympathetic nerves play a crucial role in maintaining normal functions in the eye. When these nerves are damaged, it results in the classic triad of Horner syndrome. Ptosis, drooping eyelid. The disruption of sympathetic input to the smooth muscle in the eyelid leads to a weakened state, causing the eyelid to droop. Miosis, constricted pupil. Sympathetic nerves normally dilate the pupil. In the absence of sympathetic input, unopposed parasympathetic tone causes constriction of the pupil. Anhidrosis, lack of sweating. The sympathetic nerves also control sweat gland activity. With the disruption of sympathetic pathways, there may be a lack of sweating on the affected side of the face. In cases of Erb's palsy with associated Horner syndrome, the clinical presentation includes the characteristic features of Horner syndrome, along with weakness or paralysis of the affected arm due to the brachial plexus injury. Understanding the physiopathology of Horner syndrome in Erb's palsy involves recognizing the intricate neural connections and the impact of brachial plexus injury on sympathetic nerve function. This disruption results in the specific signs and symptoms observed in Horner syndrome on the affected side of the face. Horner syndrome following obstetric brachial plexus palsy. This study discusses cases of Horner syndrome occurring as a complication of obstetric brachial plexus palsy. It emphasizes the importance of recognizing and addressing this condition in the clinical management of affected individuals. Horner syndrome associated with obstetric brachial plexus palsy. A systematic review. This systematic review explores the occurrence of Horner syndrome in association with obstetric brachial plexus palsy. It provides insights into the prevalence, clinical features, and potential mechanisms of Horner syndrome in this context. Horner syndrome in a patient with Erb's palsy. A case report. This case report presents a specific instance of Horner syndrome in a patient with Erb's palsy. It discusses the clinical presentation and the challenges associated with managing both conditions. These references highlight the clinical significance of recognizing and understanding the link between Horner syndrome and Erb's palsy. However, it's essential to consult the latest medical literature for the most up-to-date information on this topic.